Well, it is 9:24. Right now, we'd like to take a couple minutes to talk about prostate cancer. Because heaven knows, guys, we don't like to talk about it unless we're prompted to. Next month, the Zero Prostate Cancer Run and Walk is taking place in West Hartford. I'm so happy to have back on the show now to talk more about what it benefits Hartford Hospital's Dr. Andrew Salner. A pleasure to meet you again, sir.
Tim, thank you.
Good to have you here. And we were already doing so much talking about prostate cancer in general. And how much of a problem does it continue to be for men?
It's a big problem. Most common cancer diagnosed in men, about 180,000 in the U.S. will get the diagnosis this year, about 2,500 right here in Connecticut.
Yeah.
And about 26,000 men will die of the disease in the U.S. So even though we've made major strides in terms of decreasing mortality by diagnosing the disease early, it's still a big challenge.
And it is also a big challenge in the African-American community.
That's correct. For reasons that we don't understand, there's a 50% higher incidence of disease in African-American men and men of West Indian extraction. They actually have the highest incidence on the globe for reasons that we don't understand. And so that's why screening, particularly in those high-risk patient populations, is so important.
Now, you were just talking about screening. There was a very controversial decision made by the U.S. Preventative Services Task Force recently.
Right. I mean, screening is a controversy in prostate cancer, primarily because there are many prostate cancers, Tim, that are not biologically important. The patients will simply live with them. They don't need to be treated.
Yeah.
So each patient, we have to sit down and make, with their team, and make that decision about whether, if they have an abnormal PSA, they should have a biopsy, and if they have an abnormal biopsy, whether they should be treated or not. But I think it's important for men to have that conversation with their provider. African-American men should actually start screening at age 45. The rest of us should start screening at age 50, except for men who have a dad or a brother with prostate cancer. They should actually start screening at age 40.
At age 40?
Yes.
Which I'm going to be
annual PSA blood test.
Okay.
Yep.
And you know, what you just said, forgive me, it bears repeating because I think it's so counterintuitive to a lot of people. You're telling them that there are some prostate cancers where the recommended treatment is nothing.
Observation. Active surveillance, we call it. That's where we check their PSA and their exam every year. We might rebiopsy them to see if the cancer has changed, but they don't need active treatment. They actually can be watched for their cancer. Prostate cancer represents a very broad spectrum of disease, and there are some cancers that are very aggressive that absolutely need treatment right up front.
It certainly seems to underscore why education about it is so important.
That's why this event is so important, Tim. It brings awareness to the community about the fact that prostate cancer is still the most common cancer we see in men, and we really need to be actively engaged in trying to make sure we diagnose the disease early.
Because there's great outcomes if you catch it early.
There are wonderful outcomes. The 5-year survival is 95%, so we do very well with prostate cancer. We just have to know about it.
Okay. Tell us about the event, though, the Run and Walk.
Well, the event is hosted by an organization called Zero, and they have 40 events around the country to bring attention to prostate cancer. Hartford Healthcare is the Connecticut host this year for the disease. We have the largest prostate cancer program by far, most comprehensive in the state of Connecticut. We offer all kinds of options for our patients, whether it's radiation or surgery or various kinds of supports and things for patients. And so we're pleased and proud to work with Zero on this event. April 10th, Sunday at Blueback Square, there'll be a 5K walk and run. And at 10 a.m. there'll be a kids event. So for dads to want to involve their kids, and moms and families, of course, we'd love to have everybody out to Blueback Square for that 5K event for prostate cancer.
What is the goal? Is there a fundraising goal here?
Well, we don't have a specific goal since it's the first year this year, but our goal is to raise as much money, much of which stays local, for our outreach programs to reach the underserved. Tim, we offer free PSA screenings for men without insurance who can't afford it.
That's great.
And there will be actually a screening at the event this year for people who need to have their PSA checked. We'll be happy to check it for you.
And Zero's doing great work really all over the country. It's one of the larger...
They're funding research, they're funding outreach programs like ours, and they're really an up-and-coming organization that's doing great work for prostate cancer.
And before we go, I guess a Hartford Hospital board member named Greg Jones started the Black Men's Health Project.
Yes.
Concurrent with this somewhat?
We're working with Greg and the Omega Foundation to really reach out to all members of our community not only for prostate cancer, but for cancer awareness and health awareness, Tim. So a lot of that is about exercise. It's about eating the right things. It's about taking charge of your health and getting checked. And we're working with churches and senior organizations and community entities throughout the Hartford area. We offer free screenings and awareness events because it's really important to reach people who otherwise wouldn't have access.
Absolutely. It still seems like for all the benefits and all the progresses in cancer treatments, the two best things to do are to try to prevent it and catch it early if you have it.
Couldn't agree more.
Absolutely. Well, Dr. Salner, thank you so much for joining us today.
Pleasure.
Once again, folks, April 10th, Blueback Square in West Hartford. It's certainly a very worthy cause. All right, thank you.